It's my pleasure to introduce to you Monica Oss. I've known Monica for a number of years, been to a number of her presentations. We're a subscriber to the Open Minds publications. And Monica has been a force in this sector for many, many years. 30 years ago, she founded Open Minds with a couple of staff and a Mimeo machine, and she now has about 100 staff, and they crank out a publication every day, in case you aren't a subscriber, on a wide range of topics in our sector: funding, regulations, new developments in technologies, new therapies. And their scope and depth of information is just unbelievable. In addition, they do a whole lot of conferences and seminars. We've attended quite a few of those also, and they're very educational. And she has a consulting service. I don't know anyone in the field who has the scope and breadth of information about everything that's going on in technology, in the behavioral health and disabilities service sectors. And Monica is clearly the leader in all that. So it's a great pleasure to have her with us today, and my pleasure to introduce to you our keynote speaker, Monica Oss. Monica?
Well, thank you, Bruce. I am absolutely delighted to be here. I will say my only caveat is after a long pandemic, I was looking forward to my return to the Union Oyster House, but that will have to wait until next time. I'm pleased to be here and really kick off what I'm sure is going to be a day with a lot of robust presentations and robust thinking about technology in the field. There certainly is, I would say, we're at a pivot point with technology in the field. And I want to talk about, unlike the presenters that will follow me, I like to say the market landscape is the intersection of science, of regulation and politics and practice. That is where, for the organizations serving consumers in the field, they find themselves, their executive teams, their management teams, in this, I would say, in the turbulence of this transition. And I always like to, start with the perspective that while it may seem turbulent and there is a lot of change, that change has been with us a very long time. And in fact, this quote, "Change is the only constant in life," is not recent. It's not of the tech age. It actually is from the Greeks. So on days when I feel completely overwhelmed by all the change that is afoot, I take comfort in knowing we're not the first generation to be, kind of overwhelmed by change. That said, I want to start with this whole concept of digital transformation, because I think that is a theme that ties together every presentation today and all the faculty, which is, this notion that technology is going to essentially make its way into all areas of the healthcare field, fundamentally change how business is done, and fundamentally change value to the consumer. What is interesting to me, I always like to think, we have seen the digital transformation of entertainment. The streaming services reign supreme. We've seen the digital transformation of banking, and I always ask people, when is the last time you were actually in a bank? The banking sector has been through a complete digital transformation. We've seen the digital transformation of retail, something that has made Amazon kind of the market maker or the market breaker, depending upon how you want to look at it. And for better or worse, we've also seen the digital transformation of news. But I would posit as a place to start is what we haven't seen is the digital transformation of healthcare. And I think this is a really important place to start as we put all of the presentations today in context. What we saw 2.5 years ago at the start of the pandemic was not transformation, but adaptation. We saw, and very much robust adaptation, we saw the entire health and human service system make, in the period of a couple weeks, this gigantic pivot to delivering services to consumers online. And if you think about the magnitude of that pivot, and something that is, I think, the underpinning of many of the remarks today, we went in the space of a month from less than 1% of services being delivered using digital platforms to over 80% of services in behavioral health, slightly less in healthcare overall, being delivered on a digital platform. Organizations adapted by shifting their entire workforce or large portions of it to digital, and to using a platform rather than face-to-face service delivery. But I would argue that that is not transformation, and we haven't seen the digital transformation in terms of the business model or the value prop yet. I think that is what's coming. And there are three key areas. I know all of our faculty today are going to touch on them, but why is it that digital transformation is so slow in healthcare? It's a combination of regulation, of reimbursement, and lack of, I would say, a robust criteria about the appropriateness of technology for particular conditions and consumers. And that remains, as we look ahead, I have no doubt that we're going to see digital transformation in the healthcare space. The question will be, I don't think any of us know exactly what that's going to look like. But all the forces are there of regulatory relief, of pending reimbursement change, and of a growing body of scientific literature to help guide, clinical decision making about the use of technology. I wanted to point out, kind of where do we expect to see this digital transformation? As we monitor, our team at Open Minds monitor all the different types of technologies and solutions that are making their way to healthcare. They seem to be in a few key areas where we expect to see, I would say, market change in the healthcare service delivery system, and something we spend a lot of time thinking about, the sustainability of the organizations that are actually delivering the services. And those areas are in, screening and diagnostics, in referral, I would say referral management from a consumer and health plan perspective, the substitution or a parallel use of technology and treatment, certainly in remote monitoring, and last but not least, in the whole area of long-term care. And I wanted to give a couple examples of each, and for the purposes of really thinking about, as these technologies become more widespread, how does that affect the delivery system? I'm not going to talk a lot about the screening piece. There are certainly a number of initiatives out there using artificial intelligence and broad amounts of consumer data, whether that's on Facebook or some other platform, to do early identification of people who potentially have addictive disorders or depression or anxiety. So, the story is yet to be written about how those algorithms will play out and how they'll be used in the field. We are seeing, I think, some market changes in diagnostic testing. We've seen when I first saw a presentation of the Gallery blood test, which is essentially doing screening for multiple numbers of cancers with a single tube of blood. I was amazed by the concept. It's finally come to fruition. For $1,200 a test, you can get, I just listed a few of the types of cancers that it screens for. I like to point out that it's not so much the test as it's going to markedly change essentially how people are identified as having a cancer and their trajectory to treatment. But it's also going to markedly change the income to provider organizations who are providing other types of cancer screening. So we have tests like that, and closer to our space today, talking about specialty care and individuals with behavioral and cognitive conditions. We're just starting to see the first approvals and clearances, I should say, of diagnostic testing for Alzheimer's, for autism, for ADHD. They will bring new rigor, if you will, to the field in terms of early identification, and will also, I think, change how people enter treatment and that treatment pathway. Another area, if you think about screening and diagnostics, if you shift to thinking about referral management and scheduling, we are seeing a number of experiments in using measurement-based care both for assessing what consumers need and essentially placing consumers with the best available professional to provide treatment. This is one example. There are many out there of essentially compiling massive amounts of consumer assessment data and using on a real-time basis that data not only to assess, kind of the level of severity of a behavioral health condition, but also using that same data set to match up consumers to the best professional. This is going to change, I think, as we see a growing data set assessing effectiveness of treatment by consumer type and by condition, is going to fundamentally change how health plans manage their provider networks, and more specifically, how we make referrals within provider networks of consumers to particular professionals. It was funny when I interviewed the folks at Tritium who are developing this. Their comment was, well, 80% of clinical professionals are good at something, which I thought, and a question I have for our panel coming up. What about the other 20%? But we are seeing more use of artificial intelligence in linking consumers to care, both in terms of criteria and in terms of the clinical professionals. And then the piece that I think is, as we shift to talking about some of the other tech interventions and tech solutions out there, the opportunity for technology to actually help to alleviate some of the workforce problem. So we have technology as treatment that takes a number of forms. For those of you who have been around the field for a while, you know that we have had ECBT effectiveness data coming out of the UK and here in the United States for over 20 years. I was interested in the recent Headspace study about the effectiveness of using apps compared to in-person therapy, another type of intervention that we are likely to see going forward. We have an entire group of innovators looking at linking gamification to treatment. This is an example of a gamification approach for treating ADHD, but we're going to see a lot of development in that, I would say, consumer self-treatment space. As we move beyond that, I think the other piece that is going to have a marked effect on behavioral health services in particular is the growth of on-demand platforms. And I'll talk more about that in a minute. But the type of technology that links the consumer, the practitioner in some kind of real-time interaction, whether that's audio, video, text, is changing consumer expectations. As always, we're keeping an eye on the Teladoc Amazon Care experiment initiative, I guess you'd call it, to see what is the uptake of essentially accessing healthcare professionals using your Alexa. The success or failure of this particular initiative will say a lot about where on-demand services fit in the future. And then the last two, there's a huge number of, I would say, remote monitoring tools out there. And, beyond telehealth, I view remote monitoring as kind of the next big frontier for adoption for all kinds of reasons, largely because it is more able to be controlled by the consumer and because it has the potential for greatly decreasing the amount of labor force needed to do care coordination. So there are a million, I shouldn't say a million, thousands of remote monitoring solutions out there for every type of condition. This happens to be one for agitation for consumers with an intellectual disability, but there are a host of, I like to underline, passive wearable remote monitoring technologies. And then last but not least, as we think about functionality and how technology will affect current providers and health plans, you move from diagnosis and screening to referrals to the actual delivery of treatment to remote monitoring. We are seeing now, I think, the deployment of technology as I would call it, if not a replacement, an adjunct to long-term care using smart home technology. This is one example, a nonprofit in Cincinnati that is using 160 different types of readily available remote monitoring technologies in a unified fashion to allow people with disabilities to live independently in the community. I was struck looking at their case studies at the how much this enabled people with severe disabilities to live independently. The other thing, obviously, as a business analyst, I took note of is that this is the kind of technology that has allowed them to greatly reduce their FTEs per person supported by using the technology and eliminating block staffing. I think as we look ahead, this trade-off of direct support staff and technology is probably going to be one of the biggest transformational issues in healthcare, and largely driven by the workforce shortage and a U.S. population that's increasingly older and increasingly has more need for assistance with activities of daily living. So there's this framework to think about is digital transformation is going to happen functionally, I think, in healthcare and evolve as we go. For those of you listening in who are executives of provider organizations of some type, whether it's a large health system or a small community-based organization, there are some, I would say, market factors that this pending and in-process digital transformation bring to your strategy and sustainability right now. One of them is that we have seen that traditional services have, if not declining demand, declining price points. And the health plans I've interviewed have talked about their plan post-pandemic, which is right around the corner now, is the public health emergency will likely be renewed one more time and then probably not again. Their plan post the public health emergency is to actually move to two-tiered payment systems where provider organizations are paid one rate for in-home and face or in clinic, a different and lower rate for virtual visits. So there is the price compression around price points for therapy services in particular. The other piece for most provider organization executive teams is that the margin opportunities in the field lie outside of fee for service. So kind of dogging our implementation of digital solutions is the need for payment reform and how we are going to change how we pay to allow a full leverage of digital tools is a big question for every provider organization. At the same time, over the past 2.5 years, if we kind of look at this as pre and post pandemic, we've seen the position of health plans as the manager of care, the financier of care, the reimburser, the arbiter of clinical criteria and payment. We've actually seen that influence of health plans increase. The current snapshot, and these data are probably 16, 18 months old. We have almost everyone with commercial insurance, over 90%, in some kind of managed health plan. That's about 40% of Medicare beneficiaries, about 75% of Medicaid beneficiaries. So those numbers, along with the influence of health plans in tech adoption, tech reimbursement, continue to climb. We also, with digital transformation, see a loss of market share, if we think of this as revenue, for provider organizations, for people with mild and moderate conditions of all types. Those are more amenable to, online solutions that are, do not demand the same level of face-to-face therapy. And this is a long way of saying, as we look at moving from adaptation to transformation of the provider delivery system, provider organizations are going to be challenged with how to develop the kind of hybrid delivery system they need that allows them to deliver an array of digital services to, referring back to Bruce Bird's introduction, his tech-enabled clinic. and flex that in terms of in-clinic, virtual, and in-home services. And what are the technology investments that are needed to do that? So, as we think of this, pending digital transformation in the field, I wanted to talk specifically about 5 competitive effects of the technology transformation that we're seeing, and how they, both in the short term and the long term, are going to affect how services are delivered and the sustainability of provider organizations. And as we do this, I just want to invite people to ask questions along the way. As Bruce knows, I'm always up for a good debate. So, feel free as we go to just put your Q&A put your questions in the Q&A section on the platform. So a couple things we've seen as we have seen more digital health, both in terms of digital platforms and digital treatments roll out. One of them is that over the past 2 years, telehealth has made every organization statewide. And what I mean by that is suddenly when every organization had to develop a delivery system capability that was virtual, what I think many organizations realized is they no longer had to limit their, kind of market area, the service delivery area of consumers to their particular local market, that suddenly, courtesy of state licensure, their markets were statewide. So one of the big effects of the pandemic-induced adaptation of telehealth is we've seen this change in, I would say, the market definition for a lot of provider organizations along the way. And I think a great example of that is I'm in lovely Gettysburg, Pennsylvania right now. We're in a rural area in the middle of the state. But it is interesting to me that now post-pandemic, I can get health services from the large provider organizations in both Philadelphia and Pittsburgh with the click of my mouse. That was not the situation pre-pandemic, but suddenly the large health systems, UPMC, Penn, are all essentially players across the entire state of Pennsylvania. So that's a market effect that we're seeing. The other is the effects of a continuing, avalanche of investment in the health and human service space, but particularly in behavioral health and in some specialized primary care. The statistics you see on the screen are really from 2021, but we did just get the Q1 2022 investment numbers. What we saw was the investment amount remained relatively stable from the fourth quarter of last year to this year, though we saw a slight decrease in the amount of investment in digital tech, and a slight increase in the amount of investment in provider organizations. But that is to say that we are continuing to see, and this has been a trend for 5 years now, a massive amount of investment capital coming into the space, a lot of it focused on technology in the space. So those effects are being felt across the field. We do have, and related to that, large amount of investment that's coming into the field. We have a tremendous number of digital startup provider organizations or digital first startup provider organizations, depending on their service delivery field. We track as many of these as we can find. It's always interesting to me that when we think we have a complete database, suddenly new startups will pop up. But these organizations have, I think, done quite well. They have done 2 important things to the market. One of them is they have changed consumer expectations about access to care. And, if you think of this as a relatively new phenomenon, Talkspace started in 2014, and we've seen this, kind of evolution over the past 8 years. We've seen a lot of consumer messaging about immediate access to services. We've also seen, I think what has been interesting to me is the adoption of many of the digital primary startups by health plans as a way of trying to address their need for immediate access to services. So there are, I think, a huge number of these folks that are these organizations that are looking for their long-term sustainability as well, but will have, I think, a big impact on both service delivery, on price points, on consumer access, and on workforce. Moving beyond the platforms, provider organizations are, I think, both challenged, threatened, and have tremendous opportunity as we see the kind of digital therapeutics roll out on the market. The challenge part of it is as we look at digital therapeutics, and there are 7 right now that have some kind of FDA clearance. How do these things affect service delivery? Do they replace current service delivery? Do they become a service line opportunity? Are they going to essentially require tremendous amounts of investment or not? These are all questions that provider organization executive teams are trying to figure out as part of their long-term strategy. And then, we have, I think, related to all of this, I would say the merger of retail healthcare and digital, which is creating some interesting on-the-ground both challenges and opportunities for existing provider organizations. Prior to the pandemic, the large players, retail players in healthcare were moving, but not at a tremendously aggressive pace. In the past 2.5 years, Amazon, CVS, Walgreens, and Walmart have all made multi-billion-dollar investments in getting into and expanding their footprint in the retail space. And 2 important factors with this. One of them is in most of the models, both behavioral health and chronic disease management are an integral part of the retail healthcare service delivery model. The other, I've spent quite a bit of time talking to these folks and on their websites, and we'll be having a discussion with a group of them in early June. They are all deploying, I would say, advanced digital tools as part of their tech-enabled clinic that they're building in retail spaces. And then kind of last but not least, if we think about the effects of kind of digital health on strategy and the market landscape, I think what we see is that traditional provider organizations are finding themselves competing with all of these, the many newly created digital provider organizations out there for workforce, both for licensed clinical staff and for support staff as part of the process. And I did have a question about the workforce issue that I think really fits in this particular bucket. And it said, the question is that state licensing authorities will be slow in responding to reduced staffing standards for remote care and lowering staffing requirements for long-term care, yet the workforce crisis has urgency. Kind of absent authorizing legislation, how can we accelerate this trend? It is the question, the current turbulence and the question of the moment is kind of how do existing providers get the kind of regulatory and reimbursement relief that they need to actually use some of these digital tools to, ameliorate the workforce problems. I think there are, there's kind of a short and a long answer to this. On the short-term side, I think as we've seen more managed care plans managing more populations that have severe challenges, whether in the Medicaid space or the Medicare space, there are opportunities, and we have been successful in creating some initial pilot projects with the MCOs to allow, tech-enabled treatment move to more value-based purchasing of some type or some kind of risk-sharing arrangement, and that has kind of sped up that process. The flip side is that Right now, there's a lot of focus at the state level. We just came back, my colleagues and I, from a trip to Ohio, and there's a lot of focus at the state level on legislatures providing subsidy dollars for workforce. I would view that as good. It's a Band-Aid in the short term, but my argument is always, we need some fundamental change at the regulatory level if we're going to fully leverage technology to do this. And that's probably a good area of focus for provider trade associations at the state level. But I don't think we're going to see an end to the competition among these many organizations, both the traditional provider organizations and NUCOs out there for workforce. So as much as we can find ways to, essentially speed along this digital transformation, I think the better it will be for consumers. So, it brings to, if we think about the pre-pandemic digital, I would say digital solutions that are emerging, the effect of the pandemic on changing the landscape in terms of platform, we certainly at least have much broader acceptance of by consumers and payers of using online services. And we look to kind of, what do we see as that post-pandemic market landscape that's emerging? I think there are four things that we know now, even though we don't know a lot of the specifics. And that, we do know, it appears, that both payers and consumers continue to be focused on whole person care models. They're looking for integration and care coordination. And one thing the pandemic did was, by bringing in virtual primary care, the virtual models that are growing are really models that are virtual digitally and not necessarily virtual in terms of place. So, but there's the whole person care piece. There is the expectation of hybrid service delivery, that provider organizations that are going to serve consumers will be able to offer them virtual, in-clinic, and in-home, essentially over a continuum and depending on the time frame. The thing that has been most interesting to me is the pandemic effect on facility-based services. I think it's had a much bigger effect than on ambulatory services. And the reason is, we saw prior to the pandemic, there was always pushback about how much facility-based residential and acute care do consumers need. Over the period of the past 2.5 years, we've seen very innovative in-home, in-community addiction treatment. We've seen the growth of SNF at home in terms of a alternative to using skilled nursing facilities for rehab. We have seen this smart home push to have more consumers not reside in nursing homes or assisted living, but use tech-enabled homes. And I do expect that the hospital at home concept, which was authorized under the public health emergency, has fairly powerful pro-lobbying by large hospital systems in the US, and we're likely to see that stay. So not only have we seen a bigger focus on integration, an expectation of hybrid service delivery, but we've also seen the digital platforms result in an acceptance of what used to be facility-based service now being delivered virtually or in-home using an array of digital tools. And then last but not least, I think all of this after the 2020 data showed that U.S. healthcare spending as a proportion of GDP is at its height. And we don't have the final 2021 numbers yet, but the 2020 numbers came out at 19.6% of GDP was spent on healthcare. So a lot of that obviously driven by pandemic spending. But that is going to continue to push, have payers, whether we're talking about the government, employers, the VA, be more and more price sensitive and push for more, I would say, financial alignment under a variety of risk-based strategies. All of these factors are really interplay with the whole set of emerging digital tools. And then for the specialty provider organizations out there, what we see are, it is not, I like to say it is change. It's not bad, it's just different. As we look ahead to where do we see traditional provider organizations have market opportunity, certainly the big one is in how do you adopt what's happening with all of these new digital solutions to the 6% of the population with comorbid chronic health and cognitive or behavioral conditions that use 50% of the resources. That number, it's amazing to me. That number has stayed constant in terms of that proportion over the past 10 years and was just reinforced. I had a meeting with one of the kind of major health insuring companies, and across their book of business, that 6-7%, 50% proportion of spending has remained stable. So for specialty provider organizations, developing tools and a tool set and a clinical approach for those high needs, high support needs consumers, I think is one of the big opportunities that are out there. We also have the need for, I would say, a new model of primary care services for consumers with more complex needs. We have home-based services of any type, I would say, is a growing market for almost any type of service. And the last two, I think the Affordable Care Act 12 years ago set in motion something that we've seen over the past few years really get some legs. And that is the social service leg of the service continuum. With the changes 12 years ago to more mental health, more behavioral health parity, eliminating pre-existing condition clauses, eliminating annual and lifetime limits, it has changed the calculus of a lot of health plans. And I think one of the big realizations has been that it pays to invest in social support, what I have traditionally defined as social supports. But we are seeing the emergence of more targeted social support programs and this whole concept of in lieu of services, where providers package essentially alternatives to inpatient and residential care, all starting to be more robustly covered, all of them demanding both better analytics, better population health management tools, and better technology for service delivery in order to pencil out with a positive ROI. So these are some of the I would say, areas that we think we're likely to see provider organization expansion in the next 2 to 3 year period. But all of these things bring new tech requirements. The biggest one for organizations that are moving from a specialty to being part of some integrated system, the issue of interoperability still has not been fully solved. And interoperability of data across platforms, in consumer engagement is a huge piece of that kind of next generation technology. If you're a organization that has done the adaptation, you've moved from in-clinic to delivering things digitally, and are now looking at how do I develop a hybrid model that includes both of those and in-home, we're seeing that some of the biggest issues involve the technology around scheduling, both consumer scheduling, but also scheduling of workforce with multiple locations, and the need for mobile functionality for the workforce that will be out in the field, as part of that continuum. Facilities that are needing to move to, I would say, pivot from a facility-only model to some model that includes services delivered to people in home and in community. We're seeing those organizations struggle with the technology of managing across the continuum, both the kind of EHR capability, the ability to track consumers across the service delivery system, and then the ability to do pricing and accept some kind of bundled or case rate model for service reimbursement. And last but not least, as we see more downward price pressure and more of a push to move to value, there are big questions, I think, in this category that come up for most executives of provider organizations. It's a chicken and the egg piece, and I think Bruce Bird really did a great job of introducing this. It's how much do you invest in technology until you have a change from the payers that makes that technology have a positive ROI. So if we're going to have digital substitution for synchronous therapy and service delivery, that requires a reimbursement change. Any change to accepting more risk means provider organizations need a better framework for their data for population health management. They need better financial systems, and there need to be, I would say, a linkage of financial systems to clinical performance to kind of make that final step and fully embrace and be able to leverage a lot of the digital tools that we're going to hear about today. And with that, I think there's, I'd like to talk a little bit about this. I would say the new view of what is the technology that a provider organization, in this case community-based is what I focused on here, what is the new framework for them thinking about becoming the tech-enabled clinic that Bruce Bird mentioned in his opening? And it really goes, I like to say, beyond the EHR and having a financial system and some kind of HRIS to really thinking about how do I take those basic pieces of my platform, add the tools I need, mobile, EVV, whatever, for hybrid service delivery, add the kinds of consumer engagement tools that I need both to be competitive but also to be successful in generating better outcomes, and tie those together with some kind of risk-based contracting. To me, this is the new framework for provider organizations thinking about and buying digital and moving to a more holistic approach to digital. And on top of all of that, having the ability to sync the data from separate systems, from EHR, from consumer engagement platforms, from mobile solutions, from their digital treatment tools, in a way that allows them to make I would say timely management decisions, both financial and clinical. So one of the questions that came up, from the audience is, how long do you think it will take to migrate from adaptation to transformation at the provider level? And my view is that I think that we are, without some significant changes in reimbursement, and not so much the rate as the reimbursement model, without some significant changes in the reimbursement model, that will continue to be, to me, the bigger impediment to change than either regulatory relief or the, I would say, the absence of robust clinical data right now. But the reimbursement piece for most provider organizations prevents them, even with successful pilot projects, from kind of broad scale adoption of kind of new technology. But I would add another caveat that that's on the service delivery side. On the analytics side, in terms of getting the data that executives need to make decisions, we are still a long ways off from interoperability, from even within a single organization, having the kinds of APIs or processes that allow the aggregation of data from these various data sets. So I do think that, that time to transformation will depend on reimbursement. And my more skeptical side of me says the provider organizations that have executive teams that can negotiate non-fee-for-service arrangements with payers are going to have a leg up on making that transformation happen. and I would underscore having a more competitive advantage in the market. So I think I went a long ways from answering your question, but I think the answer is that we're going to see this being dependent on the relationship of the provider organization to the payer or health plan. And we're going to see a lot of variability in who can actually participate in the, I would call it, digital transformation of healthcare as a result. So a couple questions to kind of wrap up our thinking about the market and launch our day with all of our experts. One of the questions that always comes up, it's probably one of the most frequent questions we get at our office, is kind of what is the process for deciding on a technology to adopt? What does that look like? And I will say that Vinfen has developed a process to do just that. But generally speaking, the structure is threefold. My number one point is, everything starts with your strategic plan, including identifying the areas where you're going to make investments in technology. And I like to point out that the technology investment is not just the purchase of the solution, whatever it is. The bigger investment is actually in re-engineering your service delivery, changing your relationship to consumers, changing your clinical service delivery process, oftentimes changing your relationship with payers. So the quote-unquote investment is both a hard cost of technology, but a unavoidable cost in opportunity and system change. So there is the part of the strategic review. Then we have essentially a clinical service delivery review. I always like to say, and I should have added one bullet point to this list after some of my reading this past week, there is the clinical service part of it. Does the technology you're looking at have a kind of robust outcomes data, performance data? Is it up and running in other organizations? Is there a pilot at scale if it's something new? I mean, how do you evaluate that? What is the research literature that goes with it? But also, the piece that I should have added to the clinical service review is certainly the privacy issue that's come up with lots of the new technologies that are emerging on the market. So there's strategic, what does it do for competitive advantage? There's clinical, and last but not least is always the business model review. And to me, there are a couple important parts to this. Does this significantly change the service line that you're delivering? Will there be either concomitant reductions in costs or increase in revenue that go with that? Does the investment, fully loaded with time and opportunity cost, really pencil out for an ROI for the group as you're doing it? These are, I think, the core pieces of thinking about whether you're talking about something that is a diagnostic or screening technology, a measurement-based outcomes technology, one of the new prescription digital therapeutics, a consumer engagement technology. The same basic process really needs to become a discipline that executive teams use to sort through the literally thousands of options out there and pick things that make sense from a clinical service delivery and financial sustainability perspective. We did, as we look ahead, I did want to kind of leave the keynote this morning with a discussion of what I see as some of the looming issues that will affect, for the audience member who asked about how long will this migration take. I think there are the unknowns that our team is keeping an eye on, and that I think will really change the trajectory of digital transformation in healthcare. We still don't have I would say, a fully hatched, decision on what we're doing with interstate licensure laws. I think there are, during the public health emergency, we saw kind of most states adopt liberal intrastate licensure laws. I believe we are down to 35 plus of the states have repealed those interstate licensure regulations. But so we have done that. But there are 12 states remaining that have kept some degree of interstate licensure laws. So the effects of the public health emergency have not had the long-term effects at the state level that we thought. So that is one of the big issues. We are seeing some interstate collaboratives emerge. I understand that for licensed professional counselors, they just got their 10th state to agree to an interstate licensure compact. So they are moving ahead with those 10 states of granting interstate licensure as part of this. So that's another, I think, big question is where do we end up in terms of interstate licensure? What the large digital primary companies are doing are amassing networks of clinical providers with licenses in multiple states. It's been interesting to watch that evolution, but they are kind of working around that as a place to go. The other is, it is unclear kind of the future of the FDA, it's not approval, but certification of digital prescription therapeutics. What is long-term, what is the role of the FDA going to be? And the thing we are watching closely for the 7 that are currently approved, how are health plans reimbursing those digital therapeutics? What's the role for provider organizations in offering prescription digital therapeutics as a part of a service line or a revenue stream? Those are things that we don't know at this point, and we're waiting to see for that initial group of 7, what happens. I have a lot of questions for our panel this afternoon about exactly that topic. The other piece is we are, depending on, I got up yesterday morning and watched my, 5 o'clock watching CNBC. And it was grim with the forecast of, a stock market that's going to be in decline for the rest of the summer, a pending recession. One of the things we don't know is how will the kind of changing economic framework affect particularly investment in the healthcare tech space. We have had a flood of capital in this space. We don't know yet. It may increase the interest in investing in it. I don't know, but we are kind of looking ahead to kind of what will the investors do, and how will that change essentially the trajectory of development in the field is a big piece. With that, so one of the things in our practice, we have a practice, part of our consulting practice that works with investors, both venture capital and private equity firms. The one thing that I think we are starting to see is more of the investor community looking for in their assets, the organizations they've invested in, making more progress in terms of getting on the path to profitability. And being able to grow organically rather than growing by mergers and acquisitions. And I think the big impediments we're seeing to any new digital tech, a new app, a new prescription therapeutics, a new consumer engagement tool, I mean, we've kind of worked with all of them. I think there are 3 big challenges to widespread adoption of those digital apps. One of them is how well the app fits into essentially the service delivery system. And again, using Bruce Bird's opening that we had, we're really talking about in a ecosystem of a provider organization or a community, kind of where do technologies fit together? And then I would add, more importantly, what are the user interfaces, not just the consumer, but across the entire spectrum of stakeholders in the healthcare delivery system. And last but not least is the push, and I think the real need, and Bruce emphasized this in the opening, that all of those things need to have the type of API or connectivity that rolls into a central EHR or consumer data repository. So I do think we see challenges ahead for a lot of the new tech companies and their solutions to kind of get critical mass in the market. And those 3 issues are the 3 issues I think they're going to have to solve. And then last but not least, on the looming issues, we're already starting to see this, but there are probably more solutions than there are market space, particularly independent boutique solutions of different types. And we're starting to see the merger of all of those things as part of it. Now, I couldn't, and I was very glad that someone asked this question. I was planning to address this at the end. All of these factors, when we look at kind of the digital transformation of healthcare, I am very positive about the opportunity for digital transformation to positively affect health equity. I think there are advantages to using more algorithm-driven screening and diagnosis to eliminate kind of cultural bias in that point. If we can successfully do this, leveraging technology to free up the workforce to have them at their best and highest use by taking care of consumers who have more complex needs. So I think I think retail healthcare and the digital networks offer tremendous opportunity to deliver care in what have previously been sort of healthcare deserts out there, either virtually or by leveraging retail locations. But that said, I think there are some tremendous I would say challenges to achieving health equity even with digital transformation. And I think some of the more fundamental ones to think about is we still have 12 states that have not expanded Medicaid, and following the public health emergency, it's likely that there will be a significant proportion of low-income Americans who will lose access to health benefits again. The estimate is close to 5 million. So there is the kind of access at all to existing health systems. I think the literacy in general and access to education is huge, because the ability to use the digital tools relies on a certain amount of fundamental literacy. And then we have the bigger issue of broadband access. All of the digital tools, I mean, if there's anything the pandemic illustrated, and again, I'll use my little town here in Gettysburg, if there's anything that the pandemic illustrated, it was the lack of access to digital capacity. Our high school here ended up doing broadband Wi-Fi access in the parking lot, and every morning while the schools were closed, we had a sea of cars with parents and their children in the cars doing their online schooling because of lack of access to Wi-Fi in their homes. So those are from a health equity standpoint, literacy, access to broadband, I would add even more broadly, access to health insurance are fundamentals. There are some, I would say, other issues that we've written about that are more targeted. One of them is to obviously prevent the use of artificial intelligence-driven models from institutionalizing bias as opposed to solving for it. And there certainly has been a huge amount of coverage about the use of those algorithms in the child welfare field that has raised a lot of eyebrows about the potential downside of digital tools. And then the other is making sure that our performance measures, whether we're talking about CMS measuring, the STARS system, or the nursing home ratings, or health plans and their NCQA HEDIS scores, or net promoter scores, or whatever scoring system that we're looking at, is making sure that those scoring systems are adjusted in a way that we can look at subpopulations, including race and socioeconomic subpopulations, and be sure that those consumers are not sort of lost in the rounding, in terms of lost in the averaging of what those performance data are. But I do think we have I think digital transformation offers a tremendous opportunity to the field in terms of leveraging workforce, reducing costs, and addressing some of the health equity issues that I just mentioned. But we are in the process of writing the future. So with my closing, I just wanted to both thank Bruce for the opportunity, but close with a quote from one of my, I would say, favorite tech thinkers, Stuart Brand, who's been around forever. But I like his quote. Once a new technology rolls over you, if you're not part of the steamroller, you're part of the road. And I think the reason there's so much interest in this conference today is really everyone realizes that however it shakes out, digital transformation in healthcare is going to affect everyone in healthcare, and we all want to be part of, kind of, I would say, a positive transformation. So with that, Bruce, I want to thank you for the opportunity. I am looking forward to participating throughout the day.